Hi everyone! Today we're going to be discussing the recent findings from our research project. The question that instigated our research was, in patients who have been hospitalized, does adding a different form of education besides verbal increase the adherence to infection prevention protocols compared to the previously observed verbal-only teaching?
We find that retention is obviously the most important thing about teaching. Nurses always educate their patients when they come into the hospital, but if patients aren't remembering what they're being taught, then what's the whole point of it? Infection control is really important, especially in hospitalized patients, and so it's necessary that these patients know exactly what their role is and how they can better take care of themselves and be a part of the care team.
Absolutely. So, through our research, there were 4 themes that emerged. These themes include leaving patients with an invitation or a commitment instead of just verbally talking at them. Second is to provide a structured teaching program like quizzes or evaluating what things they don't know in a better format. Third, to use physical demonstration. And fourth, to use visual aids like videos or pictures.
Yeah, so with the first theme that we found with leaving patients with a commitment or an invitation, patients want to be involved in their care. So many of the studies we found, when patients are asked about their personal involvement and what they can do to best help themselves, they want to know what they can do, but they just don't know how. One of the best ways that they found is get a patient involved is after teaching them to extend an invitation to ask them to then keep the nurse accountable. A lot of times patients don't know when nurses should be doing things, and they just assume that the nurse knows exactly what they're doing. So by teaching patients about infection control and different steps that a patient should be taking, but B, that the nurses should be taking, really helps the patient know exactly what's going on in their care. Nurses that then ask the patient to say, hey, you should be noticing me washing my hands when I do these things, or hey, I should be, taking my gloves and switching them at this point. Will you ask me if I forget? Is a really helpful way in making sure the patient is involved in what they are doing and knows exactly what should be going on. We also found that it increases the retention of patients' adherence to these certain protocols. In patients in the hospital, rates of infection with MRSA and C. diff are extremely high when patients don't know what's going on and how to best care for themselves. And so we found that these rates of infection decrease when patients are holding their nurse accountable, but then also are remembering, oh, my nurse should be doing it now, I should be doing it now as well.
Yeah, so that was a really good application. Our second theme that we found was about a structured teaching program. So this was specifically in a research study about home oxygen use. And we all know that there are a lot of teaching points that need to go down with the patient when you're teaching them about how to use their at-home oxygen. So one of the best ways that the pulmonologists that were performing this study found was to use this structured teaching format that involved quizzes the next time that they came in for an appointment or the next time that they came in to teach if they were in the hospital. And then they would teach specifically to the points that the patient got wrong on this little quiz. This was a really good way to evaluate what the patient was retaining and then to teach specifically to the things that they were not retaining at that time.
Yeah, quizzes, we all hate them, but they also are very helpful. The third point that we found is using a physical demonstration. These studies that we found that used physical demonstrations were specifically pertaining to hand washing. It's an extremely important part of infection control, and quite often it found that nurses would just verbally ask if a patient or if their family member was washing their hands, and are you doing it correctly? And obviously people are going to say, yeah, I'm washing my hands correctly, but when the nurses actually observed, they noticed that family members weren't actually doing what they should. They would just, slap on some hand sanitizer, do this, and call it good. So the nurses would then go through to intervene. They had a chart with the specific steps of hand washing, and they would go through this chart with the patients and with their family members, and then they'd have them watch the nurse actually wash their hands. And then after that, they'd have the patient then show the nurse how to correctly wash their hands, and they found that this helped the patient better retain and know exactly what they should be doing in this specific and very important step in infection control.
Yeah. Lastly, the format that we found was helpful was using visual aids like videos or pictures. In one of the studies, they actually used videos to teach the parents of children going through chemotherapy the risks of infection that their child will be facing. They found that the retention rates were way higher after using a video format compared to what they were doing previously, which was just verbal teaching. This also proved the importance of infection prevention that when you involve family members. In recent studies involved with COVID-19, we've seen issues that occur because family members are less present in the hospital. So we've learned a lot about the importance of involving family members in teaching them as well as the patient about infection prevention protocols, and that using videos and pictures can be really helpful. Another study that we found was using pictures of the patient's wound and continuing to take pictures and to show the patient these pictures, which helped them to see that the things that they were doing to reduce infection were in fact working in related to their wound. So using these visual aids was found to be really helpful in increasing the retention.
Yeah. So for both of our nursing applications, I think we found that some of the most feasible and applicable things both include using some sort of visual aid. Our first application is making that teaching more interactive with the patient. Involving that commitment to hold the nurse accountable and hold themselves accountable, but also using little visual aids that are hung around the room to make that care a little bit more interactive for them. And these visual aids can be useful for literally anything that a patient might be at risk for. It can be a reminder that, they're at risk for falls and they need to call someone when they have to get up. Or, hey, I'm on aspiration precautions. Keep the head of my bed at above 30 degrees. But with infection control specifically, having something hung in, say, the bathroom that has the list of how to properly wash your hands, that will remind them every time that they go to wash their hands, hey, I need to do these certain steps. And so they can see that every day and they're being reminded constantly what they should be doing is a really great way that can make their care interactive, make them feel like they're part of the care team, and also just keep emphasizing those certain protocols.
Mm-hmm. And then our second nursing application was to implement unit-specific videos to use in teaching. So if you work on an oncology floor, you would have nursing-specific videos that teach about infection prevention with chemotherapy or anything like that on the different floors so that they're already prepared and it's easier to involve those videos when you go to teach. If you had to make a video on the spot or look one up on the spot, it would be really hard to implement this application. So by making these videos beforehand or finding ones that are already good, then it's easier to apply and easier to use with your patients.
Yeah. So, I think all of this just gets tied back that all of this information is presented to patients right on admission. And coming into the hospital can be really scary, and there's so much that you have to learn and so many risks that are greatly increased when you get there. But we can teach patients as much as we want, but if they're not retaining it, it means nothing. You can verbally tell them every single thing that they're at risk for and tell them all these steps to help prevent infection, but if it's just going in one ear and out the other, then there is no point, and it's just a waste of the nurse's time and the patient's time.
Yeah, so as nurses, if we can apply these different principles in our teaching to patients, and we will overall be able to give better patient care, and the patients will be able to be more involved in reducing the amount of infection that occurs.